Today we're going to talk about a very serious, result-oriented and advanced Panchakarma treatment, which is Vaman. Vaman is not that induced vomiting where people take glasses of water, irritate their throat and do vomiting, which makes them feel better as well. This is very different. This is a deep level of detoxification procedure. It's not like wearing a belt if you have back pain or a spray if you have asthma. This Vaman is done for those conditions which are chronic, which are incurable. This is not just for a preventive or a supportive aspect. This Vaman is an advanced and a deep level of detoxification procedure which is done to cure a disease. When patients do Vaman, we see how it helps in getting them pregnant, the condition where it was said as unexplained infertility. For those disorders which are there since childhood, where there's bleeding all over the body, there is itching, blisters, pain, there is so much of pain all over the body that even in, if the patients are using all the kinds of steroids, internal, external, still the patients, it is of no help. 20-25 years of steroids, they have seen that the skin disorder is just increasing. To cure this condition, we start the treatment with Vaman, we end the treatment with Vaman, we do certain different aspects explained in Ayurveda to cure a disease. Ayurveda is the one and only science of life where there are medicines to cure every disease, but there are different levels of Panchakarma to give them relief then and there itself as well. So Vaman is a Panchakarma which is done for results. What it really is, why is it different, what is the process, what are the benefits, what is it that makes it different from other Panchakarmas? Let's talk about this in this video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. We're talking about Vaman. Its reference comes from the Charak Samhita Sutrastan 15th chapter and Ashtang Hriday Sutrastan 18th chapter. Lord Charak, who is the father of medicine, explains us and gives us a beautiful treatment method to cure most diseases that are even those which are going to come in the future. Conditions like COVID-19, withdrawal symptoms, conditions like mucormycosis, conditions where the lungs were affected, conditions where the condition is stubborn, all treatments done across the globe. We see through Vaman Virechan, patient gets massive positive results. What it really is. Let's understand in a very simple language explained by Acharya Vagbhat. It is beautifully said as Tatra doshaharanam urdhva margam vamanam. The doshas, the toxins, doshas that are aggravated, when eliminated through the upward direction, it is called as Vaman. Then even in the regular Vaman which most people do, they drink water, irritate the throat and they do vomiting, they feel good. How is this different? Vaman is a Panchakarma where the entire body is detoxed. How? Here it is not a Panchakarma where the Koshtagat Shuddhi is done. Here this is a Panchakarma like Vaman and Virechan. These are treatments where the doshas are brought from the shaka, from the body cavity into the koshta, which is the GI tract, gastrointestinal tract, and from this tract in an effective way, natural way and induced way, in a planned way, these toxins from the shaka, it is brought in koshta, and from the koshta, it is eliminated through the urdhva marga, which is through Vaman. Urdhva marga Vaman, adhoga marga Virechan. Similar, but benefits are different, process is different, similarities here and there, it is there. Vaman, it is done for dosha shuddhi. Vaman, where not just kapha shuddhi, but also pitta shuddhi is done. Kapha and Pitta Vikar, we see outstanding results when patients do Vaman. So from the body cavity into GI, from the GI tract, eliminate it out of the system. As you know, there are two methods of treatments in Ayurveda, Shodhan and Shaman. Shodhan, where the enhanced or the aggravated doshas, they are eliminated out of the system. And Shamana, where through the herbs, the medicines are given to the patients in different combinations, different ways, where the aggravated doshas, they are brought below, and then once they are in a normalized state, results are seen in all the conditions. So Shodhan and Shaman. Most treatments, they begin with Shodhan to give good results, sustainable results where the root cause can be cured. Most diseases, they are ending with Panchakarma, because Panchakarma is also said as a Punarudbhav Chikitsa, a Punarudbhav, which means that when done, the disease does not come back. So, Apunarudbhav Chikitsa is Panchakarma. Why is Vaman special? Because Vaman is first on the list. Vaman Virechan Basti Nasya Raktamokshan. Vaman is most advanced, most serious, to be done always under proper strict guidance. This is called as Vaman. So we have patients in over 50 plus countries. We see out of, let's say 505 people, if at all, 6 months we see 80%, 50% improvement, and after 6 months there have been 2%, 5%, not much of improvements. We advise the patient to do Vaman. We see how the stubborn condition, how it is getting better. So Panchakarma is meant to be done to, get rid of those toxins that have been there in the body since years and years. What is the, indication of Vaman? Let's understand all those diseases where origin is cough. Let's say all the gynecological conditions, cyst related, cuffage, which is like the polycystic ovarian syndrome, which is like the uterine fibroids, which is like the thyroid disorders, especially the hypothyroidism, which is a kaphajanya vikar. All the kaphaj symptoms are seen in hypothyroidism. Obesity, lethargy, laziness, mood swing, all the manovikar like the schizophrenia, anxiety, depression, panic mania, all these bipolar disorders, OCD, we see when Vaman is done, patients start getting better. It is said as kapha nasti kandu shot. Nasti is without, kandu is itching, shot is swelling. Any itching, any swelling, it is not happening to the patient without cough. So when this cough is eliminated out, patients start getting the results. Most skin disorders like psoriasis, eczema, psoriasis, world's number one. Origin is cough. It is a kaphaj vikar. We see psoriatic arthritis, kapha vathaj vikar. For conditions that will be discovered in the future, Ayurveda has its sets of principles and protocols already ready to cure the root cause. So if you have a disease, you must understand, do you want to treat the symptoms or you want to treat the disease? If you think by taking a paracetamol you're curing your fever, then you're wrong. You're just treating the symptoms of fever, but the disease is just being there. Most disorders we see the origin is jwar, which is the maharog, which is fever. When this fever is treated, patients start getting results. This is why Ayurveda is so beautiful and so different, and this is why patients at the end, when everything is done, and then at the end when all doors are closed, patients get results with Ayurveda. So Ayurveda, along with herbs, it has different panchakarmas: Vaman, advanced, kaphaj vikar, skin disorders, asthma, gynec disorders, manovikar. We see outstanding results. How is Vaman ending? It is ending with Pittanta Vaman. Pittanta, where the pitta, sticky, slimy, yellow, greenish, toxic part is seen all over the bucket. Vaman is started with Deepan and Pachan, certain medicines to set and bring or prepare the digestive system for the process. Certain sneha dravyas, medicated tailas and medicated gritas are given in a suitable amount step by step, and they bring about sneha siddhi lakshan, which is the sneha, the grita if given, then grita in the burps, in the mouth, in twachagat sneha. Over the skin we may experience slimy substance or grita like substance or grita smell. So this means that the medicines that are given for Vaman, which it's a prepared process, all those medicines, they have reached to every corner of the body and the toxins are all set to come out of the system. And then Vaman is induced by various different dravyas. Dravyas like the Randia demoterum, which is the most commonly used medicine, which is the fruit of Madan, called as Madan Phal. There is Yashti Madhu, there is Vacha, there is Sheer, which is Doodh, milk. Different medications are used to clear off this toxic, aggravated doshas or the cough, you can say. So cough followed by pitta, pittant once seen, no more vomiting is done. The yellow toxic green substance is seen, patients are all relieved, they start getting better. In Charak Samhita, Chikitsa Sthan, 7th chapter, 39th adhyay, Lord Charak explains beautifully as Vamanam Shleshmottareshu Kushteshu. Kushta, skin disorders, Vamanam, Shleshmottareshu, all disorders where cough is seen. For these skin disorders where the origin is cough, do Vamana and results would be seen. Vaman is a treatment that is done in front of the patient just for an hour or two, but for the preparation it takes about 8 to 10 days or 8 to 15 days or 4 to 10 days period of time, depending on Prakruti, Vikruti, Kal, Bal, and all the other aspects. The right set of medicines are chosen by an authentic Ayurvedic doctor, given to the patient to ensure best results are seen in him or her. That's all about Vaman. Any doubts, any questions, let us know in the comment section below. This is all for now. Until next time, from Jyovis and the team, look impressive, be progressive.